Action.
Today we're going to discuss pacing on the monitor. So New Hampshire Protocol 3.1a, bradycardia for the adult patient. We want to consider pacing for anybody who is bradycardic and hemodynamically unstable. So for example, on the monitor here is a third degree heart block with a ventricular response in the 30s. As you can imagine, most adult patients in this rhythm will present hypotensive, possibly an altered mental status. So they're unstable. We know that atropine is unlikely to work in this rhythm, so we're going to go right to pacing. Pad placement, you have two options. You have the anterior lateral or anterior posterior. Anterior posterior does seem to be preferred for the pacing, so we'll do anterior posterior pad placement. We'll plug our pads into the connector. Very important, when we're pacing, we have to have at least the 4-lead monitor connected to the patient. Doesn't have to be a full 12. The 4-lead provides feedback to the monitor. At this time, we'll hit the pacer button, which will open up the pacer menu on the monitor. Fixed pacing is the only pacing the protocol allows us to do. If it says demand, make sure it changes it to fixed. A rate of 70 is a good starting point. The initial output is always 30 milliamps. We'll increase the energy until we see electrical capture. Unfortunately, because of the rhythm generator, we're not going to see the rhythm here. You'd increase to mechanical capture, we'll say 70 milliamps. Okay, we see complexes associated with our pacer spikes, we should be good to go. At this time, we'd want to confirm mechanical capture with pulses, ideally femoral or carotid. We want to stay central rather than peripheral for pulses. If we have capture, the recommendation is to increase by 10%. So if we get capture at 70 milliamps, we should go up around 7. It only goes in 10 increments. We'll go to 80, and we'll save it. There is a start button that we would have hit before increasing our amperage. So the pacer would continue. And you can exit this menu. The pacing will continue as indicated. Just remember, when you're transferring care at the hospital, make sure everybody's aware that as soon as that 4-lead comes off, the pacing will stop. So it's very important for everyone in that room really not to touch the patient until you give that order. The hospital will do their procedure for taking over pacing, typically just at a higher rate and a higher milliamperage. They'll take over, we can discontinue ours, and then they'll come back down gradually.